What are the long-term health effects of silica exposure? Have you ever wondered what happens to workers who are exposed to silica dust over time? This is especially relevant for those in high-risk jobs like logging, deep-sea fishing, and construction. Silica is a common substance found in materials like sand and rock, and when workers breathe in tiny particles, it can lead to serious health issues. One of the main long-term health effects is a lung disease known as silicosis. This condition occurs when silica dust causes scar tissue to form in the lungs. As this scar tissue builds up, it becomes increasingly difficult for individuals to breathe. Unfortunately, there is no cure for silicosis, and the condition can worsen even after a person stops working in environments with silica exposure. In the early stages, symptoms may not be obvious, but as the disease progresses, individuals may experience shortness of breath, fatigue, and chest pain. In severe cases, silicosis can lead to respiratory failure. In addition to silicosis, long-term exposure to silica can increase the risk of developing lung cancer. Workers who inhale silica dust over many years are also at a higher risk of chronic obstructive pulmonary disease, which is a serious condition that makes breathing difficult and can lead to long-term disability. Some studies suggest a link between silica exposure and kidney disease, as well as certain autoimmune disorders, although these connections are not as well established as those related to lung diseases. For those in high-risk professions, it is essential to recognize that silica exposure is a real concern. Many may not think of silica as a hazard in jobs like logging or deep-sea fishing, but if workers are dealing with materials that contain silica, the risk is present. Even storm chasers can be exposed to silica dust when working around debris or damaged structures following severe weather. Workers in these fields have legal rights to safe working conditions. Regulations are in place that requiring employers to limit silica exposure through the use of protective equipment, proper ventilation, and other safety measures. It is vital for workers to be aware of their rights and the signs of silica-related illnesses. This knowledge can help them protect their health and seek assistance if needed. Long-term exposure to silica can lead to serious health issues like silicosis, lung cancer, and chronic obstructive pulmonary disease. While not every high-risk job involves silica, those that do requiring careful attention to safety and health monitoring. Workers must stay informed about their rights and the risks associated with silica exposure to ensure they remain safe on the job.